Wanyama, nitakupigia saa moja, saa hii niko class. Eh, eh. Kata niko class. Yes, welcome to live today. Some people you have to tell them you are doing something because they continue calling and it's not an emergency. Now, um, we did Crohn's disease. We did Crohn's disease, and we have to deal with. Yes, hi. Okay, I'm online. I'm on. Okay. And you have to do some management of Crohn's disease. Crohn's disease, we say it's patchy inflammation of your intestines, mostly the large intestine. Mm. So we talked about a few things about in Crohn's disease, and we have to manage it. We had even some people or a person who said she was suffering from ulcerative colitis, and we saw the difference between ulcerative colitis and Crohn's disease. So today we will deal with the management of Crohn's. The management of Crohn's. Management of Crohn's disease is a, is a specific and a very complicated trend because it's a chronic issue. So when something is chronic, what you do is you take it step by step. So Crohn's disease, the cause of Crohn's disease itself, it was specifically not known, but lifestyle and yes, King Ray, thanks a lot. Mercy, King Ray coming on the platform. Welcome. We are managing Crohn's disease today. And the causative cause of Crohn's disease, the specific cause, we said it was genetic. Some genetic makeups that increase inflammation. Genetic makeups that increase inflammation. And the other thing we said is lifestyle. Like people love smoking. Smoking increases the chances of a person gets Crohn's disease. Lifestyle eating non-fiber foods that are processed, increases the chances of increasing Crohn's disease. So Crohn's disease, we say it is inflammatory condition, inflammation of the gastrointestinal tract, managed and management. If you remember well, we said it's the inflammation of the gastrointestinal system and the management of gastrointestinal system. The treatment itself depends on Crohn's controlling inflammation. You see, it depends on controlling the inflammation because inflammation is the first factor that comes in when you have Crohn's disease. You remember the complications of Crohn's disease, even it brings even holes, fistulas, inflammatory conditions that perforates between the walls of your intestines, and then they go through the mucosa, they go through and then until you get the Crohn's disease. So, focus of management of Crohn's disease are these ones, and these ones are the main focus when you are controlling Crohn's disease. Controlling inflammation, inducing and maintaining remissions, preventing complications, and improving quality of life. Because uh, at times, it may be something that is, you cannot heal something that is chronic and is genetic. A complication, a chronic complication is managed, it's not treated, and it wears out by itself as time goes by. So those are the main focus when it comes to treatment of and management. You see, if it could be something that is treated once and it goes, I will say treatment of, you get it, treatment of Crohn's disease. So here is, oh, someone may ask, what is inducing and maintaining remissions in Crohn's disease? It is inducing of remissions means controlling active inflammation and symptoms. And then maintaining remissions means prevent relapse and complications. So that is what someone may ask, what is that? I mean, controlling inflammation and the symptoms and preventing relapse or coming back of complications. So the main focus of our management one will be controlling inflammation, inducing and maintaining remissions, preventing complications, and improving quality of life. Improving quality of life. So we have several things that we see when we're coming up and going on Crohn's disease. The general principles of management says there is no permanent cure. Only long-term therapy and control can help this condition. Treatment depends on severity, which is mild. There is mild Crohn's, there is severe Crohn's, and there is moderate. You see, when you get a fistula, that one is severe Crohn. But when you're just having some small abdominal pains, that is mild. Moderate is between bloody stool and diarrhea. And also it depends with the location. You saw it attacks several places of your gut. So it depends. If is it in the ileum, colon, or perianal. Perianal is near where your anus is, where you defecate. Complications may make it so worse, like fistulas and stricture. Fistulas are holes that are communicating between other cavities. Like a fistula, when you want to go and urinate and urine is coming behind the, you see, that is called a fistula. Medical management, in medical management, we will also see what can help. Welcome, Hilda Taylor. Hilda Taylor is here. Good morning, Dr. Benjamin. Blessings to you and family and everyone on your channel. Big up every time. Blessings to you, Hilda Taylor, too. Jamaican uncle, thanks for coming in. J. Kingray, thanks for coming in. Mercy Grace, all of you that are here. We will follow you on your channel and see what you are doing. I know you are doing good job. So anyone who is watching, follow those people. See what they are doing, support them, and comment. Say I was here. Don't just go. So in medical management, we give anti-inflammatories. Anti-inflammatories are the main source because this complication mainly is because of inflammation. So because it is the main thing here is inflammation, we give anti-inflammatories like mesalazine. Mesalazine is a drug, reduces mucosal inflammation and more effective in colonic disease. If you have ever taken mesalazine, you know it is not an antibiotic. That one only helps when it comes to inflammation. And then we have antibiotics. Metronidazole, ciprofloxacin, all those are antibiotics. Why? Because when you are having an inflammation, and we saw when people are having Crohn's disease and having inflammation, what they form afterwards is pus. They form pus. And pus is treated by antibiotic because it's a bacteria. You get it? You saw even the fistulas that we were dealing with, they had pus formation. Pus is, I said abscess, but you see, abscess is full of pus. So we need antibiotics. And when it comes to maybe you don't have a Crohn's disease that is so severe, today our topic will be short, guys. So if you have a question, just answer. Just ask, I'll answer as we continue. We are dealing with the management of Crohn's disease. So when you have a moderate disease means it is not so bad, it's only pain, and the patches have no fistula and no pus. We deal with corticosteroids, steroids like prednisolone, budesonide. Budesonide is a good steroid that reduces inflammation. And what I may say about this, you are not supposed to use them for so long. Steroids are not supposed to be used for so long because the main action of a steroid, it reduces inflammation. The main action of a steroid is it reduces inflammation. Hmm? So we use them alternately or once in a while, not all the time, so that we can maintain our immunity. Yes, and before you use these steroids, there are some conditions that and some clinical evaluations or medical evaluations that we do to make sure that you are okay. You can use a steroid. Yes, we continue. We said budesonide and prednisolone. So if you have been using prednisolone or prednisone, when you have a flu, every time you have a flu, you run for prednisone. Just know you are doing harm to your body. Please get a prescription from a doctor so that she or she may know how to control the drugs that you are taking. Immunomodulators. There is a drug called methotrexate that is given to patients who have arthritis at times. It is given because it reduces the immune system not to hit your body so much. Azathioprine, those are drugs that are used, but the one that is used so much, the one that is common, is called methotrexate. They suppress immunity overreacting against your body and maintain remissions. They maintain remissions in that you cannot get an infections again. Severe disease. In severe disease, I mean, when you have a severe disease that you have fistula, when you get a fistula, the next thing you can do is to, yes, the next thing, sorry, you can do is to go for surgery for something called resection. So if you are listening, my guys, if you are listening to me and you at times have every time gastritis, every time generalized abdominal pain. Boss one, welcome to the platform. Welcome to the platform. We are just going through management of this complication called the Crohn's disease. Management of Crohn's disease. So these are the main reasons why sometimes you may ask, why are we giving immunomodulators to a person who is sick? Why are we giving immunomodulators to a person who is sick? It's because the condition that you are having, it is called autoimmune. This condition is eating. The autoimmune means the cells of some of the cells of your body fighting cells of your body. So because we don't want your body to fight against itself, so we give you some drugs that will reduce that condition. And that's where we give you prednisolone to reduce the immunity and immunomodulators like methotrexate. And there are some drugs called biological therapy. When used, when all the drugs have failed, like infliximab. Infliximab, you remember that time that we had COVID? There are some drugs that were used and they were so controlled. These are the drugs. They are called target therapy, biological therapy, monoclonal antibodies and therapy. Yes, those are like infliximab. Let me not mention the other ones. They act by reducing the immunity so that you cannot die by your body killing itself. You see, And then we go to nutritional management. That is very important. Nutritional management is very important. Nutritional management means um, very important on what you are taking. Hmm? The diet that is recommended is high calories, high protein diet, avoid triggers foods, spicy foods, fatty foods, and dairy foods. Avoid the triggers. Yeah? Supplements like iron are important for anemic people. You know, some people bleed when they have Crohn's disease. Vitamin B12, especially in ileal disease, folate, vitamin D, and calcium are very important. Supplements, I repeat about supplements. Iron, if you have been bleeding until you are losing blood, vitamin B12, folate, vitamin D, and calcium, very important. And then enteral nutrition can induce remissions, especially in children, prefer over steroid. Nutrition is very important because what you eat is what does what makes your stomach to be good or bad. So nutrition is very important, and even supplements, because here we are dealing with immunity and anemia. So when you have supplements that you are using, Dorothy K is here. Welcome, Dorothy K. We are talking about management of the complication that we were talking about yesterday. Now, surgical management, surgery is not curative. Uh, you know, when we are going to do surgery, this is where you have a hole somewhere around the intestine. You have a hole around the intestine. So we are resecting to make you better. But if you continue taking food, smoking, and doing those things that you're continuing to do, the disease may occur at somewhere else. And you may continue because you see, it is autoimmune. We don't know where it can attack next. It is autoimmune. So it is in Margaret in Norway. Welcome, my friend Margaret. Welcome. So it is important when we are dealing with Crohn's disease, take good care of yourself when it comes to nutrition. It is very important. Take good care of nutrition when it comes to Crohn's disease so that you can find relief, even pain. You get it? So surgical indications may be like intestinal obstruction. The disease has gone. Please don't just come and go watch. Just leave me with a like if you like the management course. If you like the work that I'm doing, please, your like is good. Some people, when they are appreciated, they feel nice. Even me, even me, I feel nice when I'm appreciated. We continue. So indications, if you have a question, please, as you listen, if you have a question, hit me with that question. Let's discuss. I said it's not today. We are not having a long session. We are just having a session to discuss management of Crohn's disease. So indications of surgery, it can be obstructed intestines, communication, a fistula. A fistula is a hole between communication of cavities, perforations, failure of medical therapy. We are giving you drugs, but they are not working. Thanks the Mutua's World. The Mutua's World is here. Someone will usher the Mutua's World in the WhatsApp group very soon. Eh? Thanks, Boss One, for your information. Thanks a lot. I appreciate. And please, if you have a question, any question away from Crohn's disease, any medical question, let's discuss. Dr. Benjamin, could you give some advice on poor circulation, and also if diet is important, what should eat? Poor Hilda Taylor is asking about poor blood circulation. I think it is blood circulation. Hmm? Or what do you mean? I think it is blood circulation. That I will answer. I will answer Hilda Taylor regarding poor blood circulation. Poor blood circulation refers when you have, when you have poor blood circulation, it means you may be having what? It means you may be having, your blood may be thick, you may be having a problem with your heart, you may be having, I'm answering Hilda Taylor the question. Hilda Taylor has asked me, Dr. Benjamin, could you give some advice on poor circulation, and also if diet is important, what should you eat? So the causes, let me give the causes before I advise. Peripheral arterial disease, like due to atherosclerosis, narrowed arteries, arteries that are narrow. Atherosclerosis, atherosclerosis, atherosclerosis means inside the blood vessels there are fats that are making the walls hard, and then we have deep vein thrombosis, clots of blood in the veins. You see, those may be the problems when we are having these conditions. And then the other cause is cardiac causes, heart disease, heart failure, weak heart, or poor circulation. And then the others, there are some conditions like diabetes, there are some conditions like hypertension. And then there are lifestyle causes. Lifestyle causes, Hilda Taylor. Yes, okay, I guess right. Yes, Hilda Taylor. Lifestyle causes like smoking causes vasoconstriction. Thanks, Dorothy K. Welcome so much. Please, welcome. I appreciate. Smoking may be a cause. Obesity may be a cause. You know, when you smoke cigarette, your blood vessels, if it is this bigger, they constrict, they become small. That may lead to poor blood circulation because constricted arteries and veins may make your end, the capillaries, even to die. Sedimentary lifestyle, eating foods and not working out, cold exposure. When you are in so cold places, we have less likes, please. Like as we listen to Doc. The Mutua's Wide World is saying we have less likes. Yes, it's less likes. Let's increase the likes. It's okay, Mutua. Thanks for that. Now, cold exposure. When you are exposed to cold, what happens is you get vasospasms and your blood vessels constrict. So the signs and symptoms will be, I'm answering this to Hilda Taylor, it is a concern to her. Cold hand and feet, numbness, pain when walking, slow wound healing because there is no oxygen wherever. You know, when a wound gets oxygen, all the healing components come in and you heal well. Skill discoloration, and then we have severe signs like ulcers on the toe, weak or absent, pulses, tissue death, gangrene. And then you continue having headaches, all those signs. But management is this. Listen to this about management. When you have poor circulation, I think this now was the what Hilda Taylor wanted to hear. If you are smoking, you stop smoking. We don't want vasoconstriction. Regular exercise is very important. Improves collateral circulation when you are doing exercises, walking, jumping, going to the gym. Always do a good diet. Always do a good diet of low fat, low cholesterol. So we don't want cholesterol to sediment in your bloodstream. And then you control your weight. There are some people when they are having, there is no stress, their weight just come. Go to the gym, avoid eating too much. So little over time. If you are eating and you're feeling your weight is coming up so big, eat little by little over time. Sometimes my lip becomes sweet as if I have eaten sweet, something sweet. It becomes bitter. Okay, let me finish this, then I answer Dorothy. Dorothy is saying, sometimes my lips become sweet as if I have eaten sweets. Sometimes it becomes bitter. What can be the problem? Okay, I will answer that, Dorothy. Let me finish with Hilda Taylor. So you see, weight control reduces vasoconstriction. Vasoconstriction. Smoking reduces vasoconstriction, and diet is very important. So diet, everyone who is living sedimentary lifestyle is having a problem with vasoconstriction. So please, let's check our diet and do exercise. When you're having poor circulation, maintain exercise. Walk around with this with this calling yeah, just a minute. Yes, kuja tu, niko okay. So we say those are the main things when it comes to management of poor circulation. It is very important, Idla Taylor, you have brought that topic here. Circulation may cause so many things to happen. Oh, I'm just answering generally, Hilda Taylor. It doesn't mean you do. I'm just giving some things that may do. You know, your question can help someone else who is having and undergoing the same thing, but you have asked and then it is helping someone else. So I'm just giving all the causes so that someone else can learn from it. I think I didn't mean it's you. I'm giving just all the causes. Now, there is medical treatment, antiplatelets like aspirin. If you are above 30, you should be taking aspirin at least twice a week. Twice a week on Monday and Sunday. On Monday and midday, you take one. It reduces your, but if you have complications with drugs like NSAIDs, don't take it. Ask your doctor first. But if you don't have a complication, aspirin is good when you are grown up to be taken at some point in life. Uh, statins. Statins reduces cholesterol. This is where you are sick and you have high cholesterol. They give you atorvastatin, which is a statin. Control your diabetes and pressure. If you have these complications, visit your doctor, let your doctor control them. You get it? So that you can live a happy family. Vasodilators, if there is any case with low blood pressure, you see, and if you are asthmatic too, vasodilators are important. When it is so complicated, surgical angioplasty, bypass surgeries, we will not go there because we are not going there. I think I've answered it, Taylor, in a best way. We continue with surgical indications in Crohn's disease. Intestinal obstruction, I said that, fistulas, abscess, perforations, and failure of medical therapy. So, uh, management of complication, if it is fistulas, you have holes in your large intestines because of Crohn's disease. We give you, oh, there was another question. Like, people nowadays don't walk, they use cars of the time and they have poor eating habits, fast food and processed food. Yes, boss one. People nowadays don't walk. They use cars all the times, and poor eating habits, fast food, processed food. That is the main problem. There was this question that I was asked here. Sometimes my lips become sweet as if I've eaten something. Eh? This is related. This disturbance is called dysgeusia. Dysgeusia, and it has several causes. Someone asked about it. That was Dorothy. Dorothy, this is, it may be caused. Let me give you all the causes so that you can know what you are undergoing, and then you can see a doctor or get a good a treatment procedure. Digestive issues, condition like acid reflux, may cause sweet lips sometimes or bitter taste at times when you have digestive issues. You get it? When you have digestive issues, you get acid reflux. So your lips become sometimes sweet, sometimes sour. Often worse after eating or when lying down. After you've just eaten or you are lying down, you feel your lips are bitter or sometimes sweet. You get it? Sometimes it can come because of blood sugar. Blood sugar, diabetes mellitus, when you have high sugar levels in your system. So, Dorothy, please go check, go do a test called HbA1c. Let them confirm if your blood sugar levels are within okay. You get it? You go to a doctor, the doctor around you will do a test called HbA1c to see if you are okay and you don't have blood sugar problems. But this one comes with excess thirst, frequent urination, and fatigue. And sometimes, this is the third cause, Dorothy, poor oral hygiene, gum disease, or infection can cause bitter taste. Brushing your teeth, I'm just giving the what I know can cause. So check if you have bleeding gums, check if you have bad breath or tooth pain. This sometimes can cause bitter taste. Sometimes. Infections, upper respiratory infections and sinus infections. If you are allergic person and you are always having infections, this one can be the problem. You get it? Medications or substance abuse. Medications or substance abuse like antibiotics and vitamins. Nerve or taste receptors problem. Dehydration or dry mouth can cause. You when you are dehydrated and maybe you have nerve problems that can cause. So if someone is always smoking comes in, smoking or alcohol abuse, and you see all those antibiotics, you may have these problems. So check yourself, where do you lie, but mostly check on diabetes. Check your sugar levels, Dorothy, so that you may be fine. So I think I've answered that correctly from Dorothy. And Boss One has told us nowadays people don't walk, they use cars all of the time, and poor eating habits, which is very true, which is very true. Now, we are still on management of Crohn's disease, and I've said when you have fistulas, antibiotics is important, plus biologics, things that can reduce your immune system not to work against itself, like infliximab. If you have a stricture, endoscopic dilation of artery, you enter a pipe so that they can dilate it, so that colon cannot be tough. If you have an abscess because it is pus, we drain and we give you antibiotics. In malnutrition, we give you nutrition care. If you go to some hospitals, government hospitals, you see some foods that are supplied. Most of them are porridge to people that contains nutrients. Mostly they are supplied to the Department of Children and Women, because many children may have problems when it comes to kwashiorkor. Lifestyle and supportive care. Stop smoking, manage your stress, be up to date with vaccination. Regular monitoring of blood tests like your sugar levels, your BP, all those. Very important when it comes to Crohn's disease. Monitoring disease symptom, blood markers, imagings when it is complicated. Imagings, I mean you do a CT scan and MRI and endoscopy. It is very important. I have realized my problem. Thanks you very much. You are a little thanks, Dorothy. Dorothy, thanks a lot. Thanks. Hope Campbell is here. Welcome to the platform. I see the lights are going up. People really like today how I'm calm. As we manage, our diabetes, no, our Crohn's disease. So if you're just coming in, please like the video, subscribe, and share. I usually say share, to a person who this information can help. Mostly, this information can help. This information can help um, a student, a layman who may not know what to do when there is a problem. So share this information, please, and like so that we can get impressions, like so that we can get impressions. You get it? Let's not just get to ourselves. Hmm? Let's not just get to ourselves. Let's help each other. Let's help each other. Let's get to know how we can do. We are 15. Please give me those likes. I'm about to finish. I've just answered to anyone who has a question to ask. I have 10 minutes right now. 10 minutes. I have 10 minutes. Now, there is a step was tap down procedure. Start mild and escalate if needed. When you are treating, we call it step up versus step down procedure. Start mild and then you escalate with treatment if needed. But there is something called top down. Start aggressively with some heavy drugs, then you go as you. So me, I usually like starting by heavy antibiotics, and then we come down as we remove the treatment. Those are the treatment procedures when it comes to Crohn's disease. So we have special situations like in children, we focus on growth and nutrition. We focus on growth and nutrition in children. We don't just give antibiotics and steroids. We check first on nutrition and immunity. And then enteral feeding, we give, it's very important. Enteral feeding is where we give in children even food by the mwambie I have 10 minutes and ngoje. We give food by the line, enteral feeding. As this person is feeding, because the person has problem with the intestinal tract, it is absorbing very little. So we continue giving even through the line. Sudden falling from weak knees. Okay, I will answer that. Just a minute, Dorothy. Sudden falling from weak knees. Um, so when a person has these complications, what we usually do, we treat both way. We treat by mouth, you eat by mouth, and we give you nutritionally by the line. You see, it's very important. There is a special situation called in pregnancy. We give only safe medication when it is when it's pregnant and when a person is pregnant. And it is very important when a person is pregnant and is having Crohn's disease to be visiting a doctor regularly, so that we can be checking the vital signs and the signs that these people. Smile in the city, thanks you a lot, welcome. Please share this as you come in, hit the like button and share to a student, share to a person who may think this video might help. Hmm? Yes, so pregnancy is a special situation. And then we have, as I finish and then I answer about, as I finish about Crohn's disease and then I answer Dorothy, is in mild situation of Crohn's disease, we use antibiotics and immune suppressors. In moderate, we use steroids and immunomodulators like infliximab. In severe, we use like immunomodulators like methotrexate. That is moderate. But in severe, we use biologics. Biologics are like what? Infliximab. In complications, we only do surgery. Let me repeat. Evelyn is saying, I'm having a problem with my eyes. They really pain me so much. Even sometimes I can't sleep. I went to the hospital, but I still have the same problem. Okay, I'll answer. I have two questions now to answer. This is, I'm repeating this. We are more. Please continue increasing the likes, please. Let's get to increase the likes. In mild situation, we use antibiotics and some ASAs, the prednisolons, you get it, steroids. And moderate, we use steroids and immunodilators. Immunodilators are like methotrexate. In severe conditions, we use biologics. But when there is a complication like fistula and perforations, that is surgery. That is all about Crohn's disease. Now, let me answer. Let me answer um, the weak, sudden falling from weak knees. You're just walking and then you suddenly fall from weak knees. The first thing you should check about is your sugar levels. When your sugar levels becomes down, goes down, you will have sudden weakness, shaking and sweating, feeling like you might collapse anytime. Hmm? When you are fasting or skipping meals, long hours without eating, please check that a lot. Hmm? Blood pressure issues. Blood pressure issues, orthostatic hypotension, the pressure that drops suddenly and then goes up. Hmm? Brain gets less blood. You get it? And knees become weak. Poor blood circulation is important feature in weak knees. We are, if you are watching and you are appreciating, a like is good. You see, Hilda Taylor has asked about poor circulation, and it is coming here whereby if you have sudden weak knees and feet, poor circulation causes less blood circulation. It causes less blood circulation. So please check if you have a problem. Go do something called lipid profile to check your cholesterol levels. Go do something called INR to check clotting factors. This is about circulation now. Hmm? Can be related to dehydration or vascular diseases in blood. Those tests that I'm saying can help you. And then we have another complication called nerve-related problems. Nerve-related problems may be a cause. Hmm? Conditions like peripheral neuropathy. Peripheral neuropathy is weakness, numbness, and tingling in the legs. Hmm? Tingling in the legs. Have you ever felt like burning on your legs? Down there, you're feeling like you're burning. And weakness, numbness. Have you ever lied on your arm and then you feel something itchy, numbing here? This might be the problems. This might be the problems. Nerve-related conditions. When a nerve is compressed and suddenly you feel weak, those are the situations whereby you feel weak all of a sudden and then you fall down. Muscle weakness or fatigue, overwork, lack of nutrients, mostly potassium, vitamin D, and B12. When you have these problems, like you have problems with potassium, vitamin B, and B12 causes your nerves to have a problem. If you don't eat well, Mama Max TV is here. Welcome, Mama Max. If you don't eat greens well, you will have deficiency in B12. You will have deficiency in vitamin D, and your muscles will be weak. Hmm? Muscles fail suddenly. We call it in medical terms, muscles, they are giving way. They are tired of holding your body. Heart-related causes, irregular heartbeat can reduce blood flow. If you have a heart-related, you get dizzy at time and suddenly collapse. Imagine, eh? Just imagine. Neurological causes, rare but important. If you are epileptic, you may suddenly feel, and you see, sometimes seizures does not mean you fall down and you start having a tonic-clonic seizure. You may just fall down and then you are stiff for some time. You can't walk and then suddenly you start walking. That is a seizure. You can get a seizure when you're looking at someone like this for 5 minutes and then it gets away, you continue normal life. We will talk about seizures at times. There is a condition called transient ischemic attack. Transient ischemic attack is whereby vitamin B12, how can we get it? Or which foods can we get it? I'll answer that. I'm saying transient ischemic attack is whereby you get ischemia. Ischemia means, it means you don't have oxygen all of a sudden in your brain. So it is transient. You lose oxygen once and then it comes back shortly. You get it? Hmm? So those are the things that you should check. And warning signs, if you have ever had this problem, loss of consciousness, sometimes chest pain, speech that is slurred, one side weakness, frequent repeating falls. Check those things that I've said. I think, Dorothy, that one I've really done it for you. Please, I know you at least you have an idea. Now, someone has asked about vitamin B12. Where do we get it? Vitamin B12, in the language of doctors, vitamin B12 is called cobalamin, mainly found in animal-based foods and is essential for red blood cell formation, nerve function, DNA synthesis, and you get it, all those. So where do we get vitamin B12 and where can we get vitamin B12? Hmm? Liver, meat, fish like sardines, tuna, and salmon, chicken, eggs, milk, and dairy products. All these are sources of vitamin B12. Fish and seafood, especially tuna and shellfish, they have it, like even sardines. Sardines, they have vitamin B12. Hmm? Someone is not liking. Hmm? Someone is not liking, man. Like we add some more likes, we feel good and impression come. We have some impression. Okay, we have dairy and eggs, like dairy and moderate amount. Don't eat a lot when it comes to dairy meals and eggs, like milk, cheese, and yogurt. This one take moderate, but fish and animal sources, those one you can eat. But we have other plant-based. We have other plant-based sources. We have other plant-based sources that are very important that we should eat. Hello? Poa, ngoja nikupigie tafadhali. That we should eat, like fortified cereals, fortified plants and milk, nutritional yeast. Those are very important. You see, cereals. I've talked about cereals. I've talked about nutritional yeast and fortified plants and yeast. So those Botswana, those are places you can get B12, which is very important for your nerves, and oral tablets that you can buy over the counter when you have a condition. But when you don't have a condition, don't go and buy those tablets. Eat food. Eat the food that you need to eat to get better. You get it? Eat food. Don't buy supplements when you have food. Eat food. So mothers who are pregnant, and that is very important questions, boss one. Um, I will give signs as we continue. I have 10 minutes now. 10 minutes, yes. Signs and symptoms of B12. It's good boss one brought it up. Fatigue, weakness, pale skin, numbness and tingling sensation, memory problems, when you have memory problems, and enlarged red blood cells. Those are the signs. So, guys, I think we have managed Crohn's disease and have answered most of your questions in the right way. I really appreciate when we come together and we share our medical problems, we ask questions, and those questions, when I answer, someone else who didn't know is benefiting from it. You get it? So my guys, let me ask, is there anyone who has the last question? Anyone who has the last question? You may ask before I leave. But remember, our group is still going on. Our group is still going on. We are still going on with our support to each other, talking, helping each other on how to grow channels, and giving ideas on how to give content. How do you test hormonal headaches? How do you test? You cannot test hormonal headaches, Margaret, but you can test hormones. So you go to a doctor, tell your doctor you usually have headaches. According to how you are presenting, there are some questions will be asked. How do you manage high blood pressure? According to the questions that will be asked, the doctor will tell you how and which hormone to check. Headaches is one of the topics that is coming one day, and we will see which types of headaches and what type of headaches do we have and how do we manage them. So we will deal with that, Margaret. Headaches, you know, you can only treat the cause. Headache, I take it as a symptom of a problem that is somewhere else that is coming or has been there. So I will talk about headaches, that is on Thursday, and we will know how to. It's a very large topic. It's a very large topic. How do you manage high blood pressure? A smile in the city, management of high blood pressure depends with what is bringing your blood pressure. If you are stressed up, you see a psychologist, will give you some drugs to bring it down. But if it is chronic, you give antihypertensives, the drugs, antihypertensives. So I have in my playlist something about high blood pressure. Go to it and say and check hypertensive disorders. You will learn a lot, but I'll go through it one day again. There are people who manage high blood pressure with food and exercise, and they avoid medication. Yes, that one I will not answer that. I will not say talk about that boss one, because high blood pressure with foods and exercises. You see, this is not diabetes. That one is unless you have been told by a doctor. High blood pressure with foods and exercises for me is a crime, and you may get hypertensive crisis if you avoid drugs. You see, hypertensive crisis will give you a stroke. So if you have been given medication by a doctor, don't avoid and say you are managing with food and exercise. What you can manage with food and exercise is diabetes, because exercise increases insulin, reduces insulin resistance, and foods, they reduce sugar level. So don't confuse hypertension with diabetes. Hypertension is strictly managed by the doctor and medication. Thanks a lot, guys. I see questions are coming. I've answered those, so I will. There are some hypertension is a topic of that is coming, but if you really need to learn, you can check. There is somewhere in my playlist that I've talked about hypertension. And Smile in the City has asked that question, so I'll talk about it. I have two pending assignments. Hives, I may, if I have time today at night, I'll talk about hives at 10. But if I don't have time, I'll talk about it tomorrow. So, guys, if we don't have more questions, what we do is I will leave everyone. We continue interacting in our group chats. We continue watching each other video and supporting each other until we grow to where we are. Thanks you a lot for being here. everyone. Let me answer other questions the other day. Bye. Have a good day, everyone. Bye bye. See you in the next session, maybe today in the evening. See you guys. Thank you for being here. Love you all. Remember to share and watch other people's channel who are here and have YouTube channels. Bye bye.